Hello, my name is Dulce Rivera, and for my informative speech, I chose to talk about birth controls, how effective they are, and the various forms of it. It's always good to protect yourself, especially when it comes to sexual health. Although male partners can always do their part by wearing condoms, which are 85% effective, women also have to take precautions. There are many forms of birth controls for women. However, some are more effective than others. There are two types of birth controls, hormonal and non-hormonal. To start with, of course, the number one form of birth control that is 100% effective is abstinence. Aside from that, there are about 17 offered forms of birth control, ranging from spermicides to birth control implants. The three most effective forms of birth control are the birth control implant, which is 99% effective, the IUD, which is also 99% effective, and the birth control shot, which is 94% effective. The birth control implant is a small rod injected into the left arm by a doctor that releases hormones, specifically progesterone, to prevent pregnancy. Secondly, the IUD is a small T-shaped device inserted into the uterus. They can be hormonal and non-hormonal, depending on what you decide is best for you. Birth control shots are shots of progesterone received every 3 months. These forms are somewhat long-term, not including birth control shots, that can keep you protected from a range between 3 months and 12 years. Some less invasive options of birth control patches and birth control pills, which are both around 91% effective. These forms of birth control have to be used on a schedule and a regular base to work properly. The birth control patches are small hormonal patches that release hormones you place on certain parts of your body. The hormones from the patch seep into your skin, therefore releasing progesterone into the body and preventing pregnancies. The patches have to be replaced on time for this form to work effectively, and you'll have to refill your prescription once you run out. In addition, birth control pills are small pills which come in both hormonal and non-hormonal forms that prevent pregnancy. They have to be taken daily, and a prescription for them has to be filled after 3 months to a year's time. Aside from this information, birth control can also have many benefits. Hormonal birth control, such as the pill, some IUDs, and implants and patches all have benefits. They can help regulate periods, make them less painful, and even help with PCOS, which includes symptoms of excess acne and facial hair in women. It can also reduce risk of getting conditions such as ovarian cysts and uterine cancer. With birth control pills specifically, women can even choose whether or not they want to menstruate by either taking the placebo pills or not taking them. With all this being said, birth control may prevent pregnancy, but it doesn't prevent STDs or the spread of them. Therefore, in addition to taking it, you also need to make sure you or your partner is wearing one form of a condom. Thank you for taking your time to listen, and stay safe out there. Thank you.